Good day and hello everyone. We're from Group 11 and I'm Myra. My group members are Anis, Serena, Lisa, Shasha, and also Kavita. Today, our group will be introducing regarding infectious diseases and globalization. Globalization refers to the increasing connection between countries through travel, trade, and communication. Today, people, goods, and information move across borders very quickly. Infectious diseases are illnesses caused by bacteria, viruses, or parasites that can spread from one person to another. In the past, diseases were often limited to one region. However, in today's globalized world, diseases can spread much faster and reach many countries in a short time. Now, moving on to the next slide. One important concept in this topic is emerging infectious diseases, or in short term, it's known as EID. EID refers to the diseases that are either new or increasing rapidly in number. These diseases are a major concern because they can spread quickly due to global connections. As an example, because people travel frequently between countries, a disease that starts in one place can easily spread to another. This shows that in today's world, diseases are no longer limited by borders. Therefore, the main argument of this chapter is that globalization makes it easier for infectious diseases to spread across countries. This means that diseases today are global issues, not just local problems. Next, my group member will explain how globalization actually contributes to the spread of diseases in more detail.
For my slide, I'm going to be talking about how globalization spreads diseases. Globalization has made the world more connected than ever before. People and goods can now move quickly between countries, which has many benefits, but it also makes it easier for diseases to spread. There are three main ways globalization spreads infectious diseases: travel, trade, and urbanization. The first factor, rapid mobility or travel. With modern transportation systems, people can move across countries and continents in a very short amount of time. This means that diseases are no longer confined to one location. In addition, individuals who are infected may not show symptoms immediately, but can still carry and transmit the disease while traveling. Because of this, it becomes much harder to detect and contain outbreaks at an early stage. Overall, increased global mobility allows diseases to spread quickly across borders. The second factor is global commerce or trade. Countries today are highly interconnected through the exchange of goods and resources. Products move across multiple countries through complex supply chains before reaching consumers. This constant movement increases the risk of spreading harmful microorganisms across borders. It also becomes much more difficult to monitor and control this risk, especially when many different regions are involved in the production and distribution process. As a result, trade acts as another pathway for diseases to spread internationally. The third factor is urbanization, or population density. As more people move into the cities, urban areas become highly crowded. In these environments, people live, work, and interact in close proximity. This high level of contact increases the chance of disease transmission. Once a disease enters a densely populated area, it can spread rapidly among large numbers of people. In some cases, challenges such as limited infrastructures or sanitization can further increase the risk. Together, these three factors, travel, trade, and urbanization, act as the main engines that drive the rapid and widespread transmission of infectious diseases in a globalized world. For my second slide, I'm going to be talking about globalization in action. First example, COVID-19 and international flights. The spread of COVID-19 clearly demonstrates how globalization, especially air travel, accelerates disease transmission. In the early stages of the outbreak, infected individuals traveled between countries before showing symptoms. Because international flights connect major cities around the world, the virus was able to move quickly across continents. Airports acted as key transmission hubs where large numbers of people from different countries interacted in close proximity. This made it extremely difficult to contain the virus within one region. As a result, what started as a localized outbreak quickly became a global pandemic. This example shows that globalization through rapid international travel allows diseases to spread faster than a government can respond. For example, 2. Bacterial spread via imported products. The second example shows how diseases can spread through global trade. Today, countries import large amounts of food and products from around the world. However, some of these goods, especially food items like meat, seafood, and vegetables, can carry harmful bacteria if they are contaminated. When these products are transported across borders and consumed in another country, they can cause outbreaks far from the original source of contamination. Because our global supply chains are complex and involve multiple countries, it can be difficult to trace where the contamination started and to stop its spread quickly. This demonstrates that globalization enables diseases to spread indirectly through goods and not just through human movement. Together, these examples show that globalization spreads infectious diseases through the movement of people and the movement of goods, making outbreaks more widespread and harder to control.
Hello, Doctor. I'm Kavita Shriyana Prampan Ketanabalan, and I would like to explain about evidence and modern example. The Road International Handbook and Globalization studies state that globalization increased the spread of infectious disease through increased international travel and tourism, expansion of global trade and movement of goods, rising migration and urban population density. For example, is HIV or AIDS originated in specific region but spread across continents. Transmission accelerated by global mobility and interconnected societies become a long-term global pandemic affecting millions of people. This is the example from the Road International Handbook of Globalization. Now, I'm going to explain about the modern example apart from the handbook, which is a monkeypox, which is also known as mpox. This is a spread to 70 plus country within a short time. Appeared in a region with no previous cases, global travel and human interaction increased transmission. Declared a global health emergency. Apart from that, we all know COVID-19 variants is also a modern example. Variants like Delta or Omicron spread worldwide within a week. International travel enabled rapid cross-border transmission. Continuous mutations cause repeated global waves, challenged healthcare system globally.
Okay, for my part, I will be talking about the weakness of global response to infection disease. First, there's an overemphasis on medical solution. Global responses focus too much on vaccine, treatment, and testing. However, this assumes that diseases can be controlled through medical methods only. If you read the chapter, we learn that diseases are not just biological but also influenced by social condition. For example, not everyone can follow medical advice because some people do not have access to healthcare. So focusing only on medical solution may not be effective for long-term disease control. For the second point, there's a failure to address social factors. Diseases are influenced by poverty and living condition, not just biology. People choices are also limited by their situation, especially if they cannot access proper healthcare. In addition, cultural practices can affect how diseases spread. So, if these social factors are ignored, the strategy will become less effective. Next, global responses also lack sensitivity to local context and cultural practices. Many policies are too general and use a one-size-fits-all approach. They are designed at the global level and then applied to different countries without considering local differences. Because of this, it may lead to resistance or misunderstanding, since what works in one place may not work in another. Lastly, there is a global inequality between countries. Rich countries usually have better healthcare systems while poor countries have limited hospital and resources. This means poorer countries have less access to vaccine and treatment. As a result, they have a slower response to disease outbreak, which makes diseases harder to control.
So, hi, my name is Anis. So, for my part, I'll be evaluating the author's argument. So, overall, we do agree with the author's main argument, which is globalization has made it much easier for infection diseases to spread across the borders. So, firstly, we can see that one strength of the chapter is how clearly it explains this link using a strong example such as HIV, AIDS, and SARS. So this case study shows how mobility and trade accelerate the transmission, and that makes the argument convincing. Another strength is the interdisciplinary approach, where the author doesn't just focus on the medical side but also consider the social, political, and cultural dimension. So, for instance, HIV and AIDS is discussed not only as a virus but also in terms of the stigma, inequalities, and governance failure. So, this makes the argument richer and more persuasive. However, there are still a weakness where this chapter tends to emphasize the risk of globalization without looking or giving enough attention to the positive side. For example, during the COVID-19 pandemic, where globalization also enabled rapid vaccine development, global data sharing, where the author doesn't highlight. So, similarly, the critique of global health institution feels one-sided. So we can't deny that it's true that the organizations such as WHO face challenges, but they have also achieved major successes such as smallpox eradications and also coordinated the Ebola responses. So while we agree with the overall argument, I think it could be more balanced and acknowledge both the risk and also solution. To conclude, I believe globalization is best understood as a double edged sword. On one hand, it clearly accelerates the spread of infection diseases, which the author is right to emphasize it. But on the other hand, globalization also creates opportunities such as cooperation, scientific collaboration, and resilience. So, my position is that the author's argument is persuasive but not fully comprehensive. A balanced perspective is that globalization bring both risks and solutions, and and recognizing both sides is essential in order for us to understand its impact on global health. That's all from us. Thank you.